Dr. Arnott is truly a special breed. He is one of the most intelligent doctors I've ever come across. He gives excellent patient care. If there is a zebra in the room, he will find it. He will be able to be an excellent family physician when he leaves this place. He truly will be able to spread his wings, and I look forward to seeing him grow. It will be an impressive event to see that wingspan.
Dr. Arnott's a good physician because he covers all of his bases. He wants to make sure that each time his patient comes in that he takes care of their health from head to toe. He doesn't want to just cover 2 problems and let them go. He wants to make sure that he doesn't miss anything when they're in the office.
Let's talk about Dr. Howell. I'm still having a tough time calling her Dr. Howell. No offense. She is married now. She was Dr. Davis for most of the time that I had her as an advisee. She's always been a person that's been a joy to have as an advisee because she's been low maintenance. I cannot say how proud I am of Dr. Davis. She's become an outstanding physician.
Dr. Davis is very self-sufficient. She's very self-confident. Her patients love her. She has very good rapport with them. She speaks to them in a manner that they can understand.
But what most impressed me was one time when we were rounding in the hospital and she picked up an upper levels patient, and that particular patient was going towards hospice care. And Christine looked further into that patient's case and said, I disagree. I think this patient has more and we need to do more. And I was very proud of Christine when she was able to alter the care, talk with the family, and the patient had been semi-comatose and awoke and is still being seen here in the Family Practice Center.
She has the compassion about her patients. She wants to make sure they're, like I said, taken care of in a prompt time. She's very thorough. She doesn't like to miss anything.
Dr. Neeru Chopra is one of my faculty mentees. I've had the honor of being her advisor. She's been a dedicated worker for us here, and we've really enjoyed having her as a resident. She's excelled in her ability to demonstrate not only the medical capabilities of engaging her patients and developing wonderful relationships, but she's been a leader among her classmates and among her peer group. In addition to all of the work as a resident that she's taken upon herself, she actually was an award-winning researcher in our program.
She's always open to hear what you have to say, what the patient says. All of her patients, when they come in to see her, she has a high show rate. People want to see her. They like what she does for them as far as her care, and she's just a good physician.
I've had the pleasure of working with Dr. Thorhallsdottir for the past year or so, and I've got to say that she's been a dream advisee for me. I know Dr. Mel had a hard time giving her up. If a patient comes in with a problem and we're not entirely certain what's going on, Margaret is the one that patient needs to see, because she is absolutely tenacious and thorough. If there is something that we're uncertain about, she will climb all scales of heights to make certain that we find out exactly what's going on.
Dr. Margaret's been a joy to work with. She spends a lot of time with her patients. The patients really love her. She takes good care of them.